Still to come tonight, there's a new heart procedure that's less invasive and has a higher efficacy rate. Find out about it coming up. And later, a week of human resources events. We'll tell you all about it. But first, here's a check on tonight's weather forecast.
You're watching Eyewitness News.
This is Eyewitness News, and welcome back. A new non-invasive heart procedure called the mitral clip is intended to not only improve the quality of life for heart patients, but also increase the chance of survival. And now this revolutionary procedure is available for Bahamians. The procedure is intended to assist with an array of heart issues, including mitral regurgitation, which occurs when the mitral valve does not close properly and causes blood to flow back to the heart. And according to Dr. Elliott Elias, doctors are able to correct the issue without open heart surgery.
When we think about transcatheter therapy, which we established, the ability to give patients an alternative as opposed to being treated medically, which doesn't completely cure the problem, is something that has been game-changing over the last 10 to 15 years. Even yesterday, we had someone that was an 83-year-old woman, and she was too high risk for surgery, and she had mitral regurgitation, which is the term that we use when there's leakiness across the mitral valve, and we were able to successfully remove most, if not all, of the leak across her mitral valve.
Dr. Elias explains how the mitral clip procedure works.
So most patients will be able to be sent home the next day, or within a much shorter amount of time, because the blood vessels obviously heal much faster than when you're making an incision in the chest. For the mitral clip procedure, we access the heart through the patient's groin in the venous system, which is a low pressure system, which makes it even lower risk than some of the other procedures that we do on the arterial side, which is more of a high pressure system. And by using catheters, we're able to actually, in a sense, pinch the valve closed, so the leakiness is ameliorated or improved, if not completely abolished. And it's a procedure that takes, on average, about 30 minutes. That's the actual part of the procedure, of course.
Well, if